You might be tired all the time, and you're tired of being tired all the time. And you're not alone. According to studies, 75% of adults aged 35 to 55 struggle with some symptoms of fatigue. But what if knowing what those symptoms are can change how you approach why you're tired? Today, I'll be showing you what are the common causes of fatigue and what you can do about them. Hey guys, Jeremy, back again with another video. And today we're going to be going over what are the common causes of fatigue and why you're so tired and what you can do to overcome them. So I did some research. I got some slides here that we can go over, and we're gonna be diving maybe not so deep, but surface level. Maybe in another video we can dive deeper, and we'll go over the information. Let me know if you would like to know more about stuff that I cover here. Then I can go do further research on. So let's get into it. So research indicates fatigue is extremely prevalent in the age 35 to 55 group, with studies reporting up to 70% of middle-aged adults experiencing some level of persistent fatigue. And the causes can be obvious, such as lack of rest, but often have hidden roots. Extensive scientific studies, reviews, and surveys consistently show that fatigue is a multifactorial symptom influenced by a blend of physical, mental, social, and lifestyle factors. The most well documented reasons include, so the most common causes of fatigue. So there's seven of them that I'm going to go over today. So it's lifestyle factors, sleep disorders, chronic and acute medical conditions, mental health and psychosocial factors, medications and medical treatments, environmental and social contributors, and mitochondrial dysfunction. So those are seven things. So when it comes to lifestyle factors, things like poor sleep habits and sleep deprivation. So you can have things like poor sleep hygiene, irregular sleep or irregular sleeping hours, staying up late or using screens right before bed. Those are some things that can contribute to poor sleep. Lack of physical activity and or excessive exertion. If you're not using your body, you're going to get more fatigue because you're not moving around, you're not exerting energy. And on the flip side of that, excessive exertion. So if you have a very physically demanding job, so that definitely will add to fatigue. And next is unhealthy diets. So including low nutrient intake, high in processed foods, low in fresh produce and water. So those are some contributing factors to an unhealthy diet, which causes fatigue. Then there's excessive caffeine. So caffeine can give you an energy boost, but too much of it can cause you to crash, especially in the next mornings. Why you would feel so tired because you had consumed too much caffeine the day before, and your nervous system and your energy centers are just depleted. So that's kind of why excessive caffeine is not a good thing. Then there's emotional stress, burnout, and grief. So definitely emotional strain can cause a lot of drain on your body. It has a lot of factors that are not would not be top of mind that you would think that would be issues, but definitely emotional drain is a big and real thing. Then there's boredom or lack of engagement in daily life. So not being active in your daily life or being disengaged is also kind of tied to emotional stress and emotional strain. These are types of symptoms that come up when it comes to depression and stuff like that. So you feel very disengaged and very unmotivated to want to do things. And then also is excess alcohol and drug use. So excess alcohol, it's pretty obvious that your body takes a lot of work to process the alcohol when you consume it. So consuming it in excess, you're gonna feel not so good the next day, like a hangover. And then drug use, definitely the same thing. Your body's working to process these things out, and it may give you a boost or a high at the time, but then the downside causes a lot of fatigue symptoms, especially when it comes to alcohol. You definitely don't get a restful sleep because your body is working to remove it from your system. Even though you will fall asleep, you probably won't get a restful sleep. That's why, like, if you drink all the time, you don't feel rested when you wake up in the morning. It's because your heart rate is elevated the entire time that you're sleeping. So it definitely doesn't allow you to rest. So now we get to sleeping disorders. So stuff like insomnia and obstructive sleep apnea. So sleep apnea is when you stop breathing while you're sleeping. So if you've ever woken up in the morning and you feel like you're in a brain fog and you're still like, oh, why does my head feels kind of foggy, especially if you feel it in the front part of your head here inside your head, that's most likely you weren't getting enough oxygen to your brain while you were sleeping. That's probably why you feel so foggy or lightheaded or not quite fully all there. So that is a factor of that. And sleep apnea is definitely a very serious thing. And then there's other disorders leading to unrefreshing sleep or nighttime disturbances like restless leg syndrome. And like I mentioned earlier, if you drink, that will also cause an unrefreshing sleep. Then next, we got chronic and acute medical conditions. So, chronic disease such as heart disease, diabetes, chronic kidney liver disease, cancer, COPD, Parkinson's, multiple sclerosis, rheumatoid arthritis, and fibromyalgia, and chronic fatigue syndrome. So all of these things can add to why you feel fatigued, especially if you take medication for some of these conditions. Those medications could be causing your fatigue to be, I want to say elevated, but it could actually be amplifying your fatigue symptoms because of the medication that you're taking. Then there's acute infections, so viral infection, bacterial, and post-infectious states, anemia and vitamin deficiencies such as B12, D, and iron, and then autoimmune diseases, thyroid disorders like hypo or hyperthyroidism, and endocrine disorders, including adrenal insufficiency. And there's mental and psychosocial factors. Now, you got depression and anxiety disorders, burnout and psychological trauma, and then there's also chronic psychosocial stress from work, family, and financial pressures. So these can constantly be on your brain and weighing on you, especially when it's on your mind all the time. What you're constantly thinking because your brain actually burns a lot of energy when you're using it. And so that's why a lot of jobs that require a lot of thinking make you feel exhausted at the end of the day. So I don't know if you've felt that way or you've noticed that or felt that way when you do tasks that take a lot of thought for you to do, you tend to be very taxed or fatigued towards the end of the day. Then there's medication and medical treatments. So drugs like antidepressants and antihistamines, like antipsychotics, blood pressure medications, and pain relievers and sedatives. So if you have any types of aches and pains or types of injuries like that, they'll give you pain relievers or sedatives, and then really strong ones will put you to sleep. Antipsychotics and antidepressants, you're meant to, especially like for anxiety disorder or depression, they definitely affect the chemical balance inside your body. It may cause to either bring you down or up, right? So they're depending on what you're taking. And then there's cancer therapies like chemotherapy and radiation. So these are definitely shown to be draining on your body. And then next is environmental and social contributors. So environmental toxins like air or water pollution and chemical exposure. So your body processing all these things can definitely cause fatigue. So poor living or working conditions. So noisy or unsafe environments. And then sick building syndrome. So I don't know what that is, but I just found that. So I put it on. And then social isolation and lack of support. So feeling completely isolated by yourself can be very draining emotionally. So that could be a factor of fatigue. And then last is mitochondrial dysfunction. So the mitochondria are the energy factories of your cells. So this is where your cells generate power. So it says here mitochondria are the energy factories of the cells generating ATP, the energy source for all cellular processes. When the mitochondria are impaired, less ATP is produced, resulting in cellular and whole body fatigue. And then studies show that mitochondrial dysfunction can occur due to genetic factors, viral infections, toxins, oxidative stress, and post viral syndromes, all leading to disrupted energy production. So, next is oxidative and nitrosative stress. damage mitochondrial enzymes and membranes, further reducing their efficiency. Researchers consistently find increased oxidative stress and reduced antioxidants in patients reporting fatigue. So, other things that factor into mitochondrial dysfunction is like low coenzyme Q10. So, this is an essential for electron transport chain functions. And then there's abnormal carnitine levels. So, carnitine for a fatty acid metabolism. Well, carnitine is critical for a fatty acid metabolism. And then reduced ATP production, recycling efficiency, changes in mitochondrial gene expressions, and decreased mitochondrial number, shape, or size in muscle biopsies in fatigue related disease. We're moving on to more subtle and commonly missed signs of fatigue: lack of motivation or apathy. So, feeling indifferent, losing interest in activities you used to enjoy, or not caring about outcomes in classic but often ignored sign of ongoing fatigue. There's difficulty concentrating, like brain fog. So, trouble focusing, making decisions, remembering simple things, or feeling mentally sluggish, even if you're getting enough sleep, signals underlying fatigue. So, mood swings and irritability. So, becoming more irritant or becoming more impatient, frustrated, or snapping at small annoyances can be a sign that your emotional or physical resources are depleted. And then short term memory problems. So, forgetting where you place things, missing appointments, or struggling to recall recent conversations, even when not feeling tired, can indicate chronic fatigue. So, muscle aches and generalized pain. So, unexplained muscle soreness, headaches, joint pain, or feeling like you have like flu like symptoms without a fever often accompany lingering fatigue, especially with hidden inflammation or chronic conditions. Appetite changes, reduced appetite, or conversely unusual cravings for sugars or carbs, especially when coupled with other mild symptoms can be warnings, especially coupled with other mild symptoms can be early warning signs of tiredness or and metabolic imbalance. Vision issues, occasional blurry vision, trouble focusing or focusing your eyes, or increased sensitivity to light are also associated with fatigue, but barely recognized as such until severe. Sleep that isn't restorative, waking up feeling unrefreshed even after a full night's sleep. It's a key sign of underlying fatigue and signals possible sleep disorders, inflammation, or stress overload. Then there's poor hand eye coordination and slowed reflexes, dropping things more often, stumbling, or finding physical tasks oddly difficult can be subtle signs that your nervous system is fatigued. Digestive trouble, increased constipation, bloating, or other GI issues can reflect a body under chronic stress and fatigue, even when not obviously tired. So, those are the more uncommon causes of fatigue that may go unnoticed, or you may not recognize them as being fatigue. Now, why these signs are missed? So, many of these symptoms overlap with everyday stress or lifestyle issues, making them easy to dismiss because they don't always show up as classic sleepiness. People often attribute them to aging, being busy, or unrelated causes, delaying proper diagnosis and management. So, just a quick thing on blood pressure and cholesterol medications and fatigue. So, scientific studies confirm that fatigue is well recognized side effect of several major heart and cholesterol drugs, including beta blockers, ACE inhibitors, and statins. So, beta blockers basically what they do is they'll slow down your heart rate. So, that is the main driver of why it causes fatigue. And statins are have been shown to affect mitochondrial function in the muscles. So, and we covered mitochondria earlier. So, that is the main thing. I think it reduces the CoQ10 uptake or intake in the body, so that is one of the main reasons why statins are the causes of fatigue. What works to fix or address fatigue? And this is according to the research. Number one, you want to address underlying medical issues. Diagnosis and treatment of sleep disorders, chronic diseases, anemia, or hormonal issues is critical. And Regular health checkups can spot hidden contributors like thyroid or iron deficiencies, vitamin D, or other deficiencies. And then, two, you want to do lifestyle interventions. So, regular moderate exercise, even light to moderate activity, reduces fatigue and boosts energy over time. Improve sleep hygiene, set a regular bedtime, limit screen time before bed, and create a restful environment. So, nutrition and a nutrition balanced diet or a nutritious balanced diet. Focus on whole foods, hydration, and limit caffeine and alcohol. Energy conservation techniques, especially for those with chronic illnesses, pacing and planning activities prevent overexertion. Therapies and psychosocial approaches. So, cognitive behavioral therapy or CBT shown to reduce fatigue, particularly when fatigue has a psychological component. Mindfulness and relaxation and stress management. Meditation, yoga, and other techniques have positive effects, especially on stress related fatigue. Then, medical health support of physical therapy, tailored movement interventions can help those with fatigue from chronic conditions or physical deconditioning. And then multidisciplinary management. Some cases require input from sleep specialists, mental health professionals, and nutritionists. The fifth one, other supportive measures. Social support and counseling, building a support system and having honest conversation about burdens can relieve emotional fatigue. Workplace adjustments, more flexible scheduling, or stress management resources have been found helpful, especially for burnout related fatigue. So, key takeaways: fatigue among age 35 to 55 is common and rarely caused by just one factor. It's usually a blend of medical, psychological, lifestyle, and social contributors. Hidden causes such as undiagnosed conditions, poor sleep, mental health issues, and chronic stress are often overlooked. Research supports a holistic approach, address medical issues, improve sleep, activity, diet, manage stress, and build social and workplace supports. Therapeutic approaches like CBT, mindfulness, energy management, and exercise stand out as effective interventions for reduced fatigue. If you're somebody who's looking for that extra support, I may be able to help with that. So I'm a trained NLP practitioner and I'm working on getting my ICF certification for life coaching. And I can help you when it comes to social support or even when it comes to mindfulness and working on managing your stress. I can work with you to create a program that works the best for you in your situation. That's all I have for you today. If you guys, let me know if you guys like the video in the comments down below. Is there anything that you'd like me to dive deeper on? Let me know down below. And you are interested in working with me on getting some coaching services, then definitely let me know down below. I'll link my email in the description. But until next time, that's all I have for you today. See you in the next one.